Hi there, everyone. Happy Thursday, July 2nd. I'm Rendi Murphree, epidemiologist and director of disease surveillance at the Mobile County Health Department. I'm here to give you our daily update on the effect of the COVID-19 pandemic on Mobile County residents. You can tell we're not in our media room today. We're coming to you today from our recording studio, a little bit more casual environment, but it's working better for us here today. So just to start with some of the numbers worldwide, there have been more than 10.7 million cases of COVID-19 reported around the globe, with greater than 517,000 COVID deaths. In the United States, we're just over 2.7 million cases with over 128,000 deaths. In Alabama, the grim statistic that we have now more than 40,000 cases of COVID-19 in Alabama and 985 deaths. In Mobile today, July 2nd, we're reporting 3,825 COVID-19 cases. That's an increase of 106 cases were added yesterday, with 301 total hospitalized. That's a few up from yesterday. 138 died. That's, I believe, an increase of 2 since yesterday. And our presumed recovered statistic is the percentage of people who are recovered is going down slightly, because most of the cases now are recent that have happened in the last 8 days or so, but around 44% who are presumed recovered. I mean, it's just startling to see the number of days that we have had greater than 100 cases of COVID-19 reported to us, when just a week ago our highest had been in the high 60s or low 70s. And so now we've had 5 days in the last 10 days or so with greater than 100 cases reported each day. And I don't expect this to get any better. I'm hearing from our case investigators that there are just tons and hundreds of lab reports coming in that they are having to sort through each day. I do want to comment, if you look at our daily report, you can see here on the age chart that most of the cases are in that 25 to 49 age category. And, those, 18 to 50 is where we're seeing most of our cases lately. That's really driving our accelerated phase of community transmission. So luckily, those are the people that are going to have the most mild or asymptomatic infection. And what we need to do is make sure that these are also the people that are wearing face coverings when they are out in public, so that they don't unknowingly infect people who have underlying health conditions, immunosuppression, or are obese or older that might suffer severe complications and death from COVID-19. So even though the Mobile County Health Department offices will be closed to the public tomorrow, July 3rd, in observance of the 4th of July holiday, our daily report will still be will still be published tomorrow, and will be sent out by our information officer and posted on our Facebook site. So a couple other announcements. I stand up here every day and talk about our main public health messages, and I'll remind you what those are. Wash your hands frequently. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay at least 6 feet, about 2 arms length, from other people. Stay home when you're sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces, and wear a cloth face cover when you go out in public. So until a vaccine or treatment for COVID are approved, these simple measures can help Mobile County remain as safe as possible during these times. When you can, be a hero, stay home, and save lives. So these are the consistent messages that you've been hearing from public health, but we thought you might be interested to know that we have endorsements for these public health measures, these recommendations, these everyday preventive actions from the Unified Command, which includes the health officer, the mayor of Mobile, and the county commissioner. We also have support from most, if not all, of the city mayors in Mobile County, also from the chief medical officers at all of the local hospitals, also support from the American College of Obstetricians and Gynecologists, from the Alabama Academy of Family Physicians, of the Alabama chapter of the American College of Physicians, and from the Alabama chapter of the American Academy of Pediatrics, all with letters and signatures and verbal and endorsement about these very easy preventive measures that everyone could take to keep our community safe and protect our most vulnerable community members. You have probably seen on the news that the city of Mobile Council voted to issue an ordinance to require wearing face coverings in the city of Mobile, Alabama, during the COVID-19 public health emergency. As soon as this is published publicly, it will become enacted, or will become an enforceable ordinance. I believe it's going to be for just 30 days to begin with possible extensions based on the number of cases, hospitalizations, and deaths that we see. It's not going to look good over the next couple of days and weeks. We are going to continue seeing record numbers of cases, and we're starting to see cases rise of people newly admitted to the hospital and who are dying from COVID. So I believe this was supported by our health officer, Dr. Bert Eicholt, and also our chief medical officer, Dr. Laura Cepeda. We're very grateful for the work that they have done to assist the city in making this decision. And we're requesting that the city that the ordinance will be, a similar ordinance will be implemented at the by other city officials, because again, if the city publishes the ordinance, then it has sort of the ability to enforce that ordinance. If it's just the health officer doing it, we don't have enforcement capabilities. However, you probably will see at the end of the day a health order instructing the mandatory wearing of face coverings in non-city locations. So in parts of our county that are not covered by a police jurisdiction or a city jurisdiction, I believe Dr. Eicholt will be releasing an ordinance or a health directive or health order to cover the parts of the county, residents in parts of the county that don't fall under any city ordinance. So more on that as we move forward. Let me just check my notes here and make sure that was all I needed to say about that for now. Again, take a look at that, because as soon as it is published, it will become effective. Okay, couple of media questions. So someone wrote to say, we're hoping to get an updated count on how many complaints we've received about businesses whose employees aren't wearing masks. So I checked just before coming in here. I got off the phone with Jean in Inspection Services. Thanks, Jean. She tallied that just using the iscomplaints@mchd.org email address, there have been 64 complaints just to that email address, and we have a couple others that we're receiving complaints on. Again, we have a team working with schools, a team working with healthcare facilities, and a team working with other types of facilities that aren't permitted, like hair salons or businesses, big box stores that aren't permitted through our inspection services. So we have received many more than 64, but just on permitted establishments, 64 in the last week. And again, what Mobile County Health Department is doing is taking those complaints, contacting the permit holder or the business owner, the business manager, or the manager on duty, letting them know that we have received a complaint, that they are not adhering to the Safer at Home order, making sure that they are informed and educated of the requirements of the order, and try to encourage compliance with things like mandatory face coverings for employees in restaurants that interact with members of the public. Here's a comment that I may have seen, stories coming out of the middle part of the state about Greek organizations having COVID parties. This has been in the national news today too. And, it's just it's just wild to me to think that young, healthy people are not understanding how serious this pandemic is, particularly on our populations that are older or have underlying medical conditions. And, intentionally trying to get infected with COVID is just, in my opinion, just a reckless endeavor. And I hope that these individuals don't inadvertently transmit COVID to someone who has serious illness and dies in their family, because I would not want to be sort of strapped with that guilt the rest of my life. And I hope that this coming to the media attention and the public attention, hopefully their parents and grandparents will give them a good scolding, and we can try to curb this from happening, because it's just it's extremely reckless. All right, what is the recommended protocol for testing when an employee or an employee's relative turns up positive? So, we are conducting case investigations here at Public Health. That's what we do. We also conduct contact tracing, and it's tricky what the exact recommendations are, because they change a lot and it differs. It matters if you are an essential worker or a not essential worker. It matters if you're a healthcare worker or not. It matters if you are a healthcare worker wearing a mask or not. So there are a lot of subtleties. In general, if you are around someone that has COVID-19 or you suspect they have COVID-19, you need to go home and stay at home for 14 days, monitor your symptoms, quarantine yourself, so that you're not out about in the community when you develop symptoms and you're spreading it and don't even know it. So that is the rule that everyone can go by. If you think you are exposed, or if you're told that you were exposed by public health, you have to quarantine for 14 days, no matter what. A single negative test does not get you a get out of jail free card from 14 days of quarantine, because a single negative result really has no value in determining that you don't have COVID infection. What happens is people are starting to get tested too soon after exposure. If I was exposed yesterday and run out and get a PCR test today that's negative, it's likely a false negative. If I got infected yesterday, I probably will not have enough virus in my body to be detected by PCR for at least 5, 6, and 7 days. So if you are a business owner and you think that you have a COVID positive employee, please call us and let us work you through the recommendation. Please don't just send all your employees home and tell them to go get tested that day, because a negative test too soon will give people a false sense of security and make them think that they don't have COVID when they may actually still be incubating virus and may become infectious just 2, 3, 4, 5 days later. So please contact us if you are unsure about what to do. We will also talk to you about disinfection, about reopening, about how you got into the situation of everybody in your workplace being exposed when you should have been following some good recommendations for avoiding that under the safe reopening guidelines. So we can help you avoid that situation. We can talk you through it. We can help calm fears. We can tell you where you can send your employees for testing, all of those things. We're here to help. We're doing our best, and we will talk to any business, any company, any agency that wants to consult with us. We have a new email address for those types of things. It's covid19@mchd.org. Now, that is not the number for individuals just wanting to get information about COVID. But if you are an owner or a manager or a supervisor, or if you're a superintendent, or you have a business, or if you, any agency, any entity, any facility, if you're a nursing home or a hospital, send your inquiry to covid19@mchd.org, and we will help you talk through some of those very complex decisions about, should I send everybody home? When should everybody get tested? How much of my facility should I close down? When can I reopen it? All of those things are super complex. Okay, here's a comment from the media. Several days ago, the state lab got backed up. What is testing capacity in Mobile County, and can anyone get a test for any reason? There are periodic lab backups. Commercial labs also are starting to see delays, some of them, in the time in which they can turn tests around because, the supply chain of specimen collection kits, reagents for certain platforms, they're tightly controlled. And when we see a surge in the number of cases like we are seeing now, it stresses the system. And I don't know what the total testing capacity is for Mobile County because there are about 80 unique laboratories that have reported test results just on Mobile County residents, and many of them are even outside the state, all over the U.S. I've been told by the state lab that statewide, for laboratories that are in the state, that the capacity for testing is about 16,000 tests per day. And then the last part of this question was, can anyone get tested for any reason? Yes. At Mobile County Health Department, anyone can get tested for any reason. Call 251-690-8889 to schedule an appointment at one of our 8 locations around the county, and we will collect your specimen and send it for testing at no cost to you. Okay, let's see. So again, someone asking about COVID parties and how do we stop that kind of behavior? It's incredibly difficult to change attitudes and beliefs and behaviors when there is a new or different threat to human health or safety. I think in my lifetime, what resonates with me most is what changed after 9/11. There was so much backlash to, the Transportation Security Agency asking us to remove our belts and take off our shoes and take our jackets off and, not put liquids in our suitcases. And there was so much resistance to that early on because it felt like it was just sort of, a restriction of our rights or our liberties or something. And what it was trying to make us, the U.S., it was trying to keep us safer. And now, if you want to fly, you just, you take your shoes off, you take your belt off if you're asked, you pour your water out if you forgot to take your water bottle out. It's just become a part of our lives. And I think it's going to take time to change behaviors and attitudes. I think we probably are going to see, unfortunately, a lot more disease and death before maybe people take it seriously. So I wish I had a simple answer for how we can help, try to compel people to change their attitudes and behaviors, but I think it's just going to take some time. Why are child care providers not wearing masks? I don't know. They're instructed in order to do so in the Safer at Home order, and it was just extended to run through July 31st. It very clearly says that people in child care centers or daycare centers or schools for kids, for babies and toddlers, and that they are supposed to wear masks. We've had several daycares that have had to shut down because they were not doing that. And please, we need you to stay open because we need your parents back working to drive the economy and make sure we have food and electricity and critical services. So please have your employees wear masks and follow the Safer at Home order. Let's see. This is a question that came in, it looks like, since maybe we've been standing here. Okay. Could you ask Dr. Murphree if I might mention to people who are supposed to be at home quarantine for 2 weeks that just because they feel good does not mean they are not contagious? Yes, Quarantine for 2 weeks means you stay at home and you stay away from people and you monitor your symptoms. We realize that you may not feel ill, right? That's the definition of quarantine. You have been exposed and you are not sick, but you need to stay at home for 14 days because that's the duration that it would take. 99% of the people, if they're infected, will become sick within 14 days. Most of them at day 5.1, to be exact, on most of them. But you have to stay home for 14 days because you could become contagious at any time, even if you feel well. So if you have been instructed to quarantine, do so voluntarily, please. And if not, we can issue a health order and deliver it to your house and explain that quarantine means stay at home. Not stay at home unless you feel ill. Stay at home for 14 days. All right, anything else, Mark?
The Friday.
Yeah, tomorrow. Yeah, I think I mentioned that tomorrow, Mobile County Health Department, all our locations will be closed to the public in observance of the 4th of July holiday. I will be running the data, and our partners will be helping us with the report, and our public information officer will be pushing the report out there. So I'll look to tell you.
And Saturday clinic is also not running.
Oh, okay. And Mark's reminding me that our Saturday clinic at the Keeler location downtown on North Bayou is also closed in observance of the 4th of July holiday. So we're very it's a tough time. I keep saying this is the worst part of the outbreak that we have encountered since we began. But we feel it's important to give as many employees as possible some time to be at home with their families and to rest, despite this very difficult time that we're entering in this, extreme accelerated phase of the outbreak. So last thing, I want to remind you to be safer at home during the 4th of July celebrations. So, there will be no fireworks in the city of Mobile. So we suspect that there may be more sort of, do-it-yourself fireworks. Please exercise extreme caution when, igniting any firework, even something as simple as a sparkler or a firecracker. Please proceed with caution. Do not let children play with fireworks alone. Please make sure it's under the supervision of a sober adult. Also want to remind you about water safety. There may be people boating, swimming, tubing. If the weatherman can give us better news, please be conscious of water safety, wearing life preservers that are required, particularly when you're sporting or having, activities on the water, because, we don't want to see anyone lost, to drowning or water injuries, boating injuries over the 4th of July holiday. The other way to stay safer at home for 4th of July is to think about food safety. So we want to make sure you keep food at proper temperatures. During COVID, we don't want you using a buffet style serving where everyone's touching the same utensils, getting their own food. Please, sir, if you have all the food out in a buffet, have one or two persons, who has clean hands and has a mask on, spooning the food out onto plates. We don't want people spreading COVID that way. Keep the temperatures right so that you don't have gastrointestinal illness associated with your 4th of July dinners or lunches or celebrations. And water, fireworks, food safety, and then also, of course, COVID safety. So, make sure that you maintain that physical 6 foot of distance, wear your face covering. If you live in the city limits, it's now required anytime that you're in public and in any public inside space like shops and businesses, that sort of thing. So please do your part to help us slow the spread of COVID-19 and keep your family safe during the 4th of July holiday. We just wish you wellness and safety, and have a great weekend, and we'll talk to you on Monday.